So for instance, sometimes the first concussion you really got nailed, second concussion, a decent hit, third concussion is just really kind of jarred your head. You know, those are the things that you get concerned about. Another thing we worry about is immediately following a concussion, your risk for a repeat concussion is much higher. So the evidence shows about the first 10 days, that's where the risk of a repeat concussion is highest. Okay? So setting them back too soon, they're in that period where they're high risk for repeat concussion. There's something called second impact syndrome, which is a little bit controversial, but it's fairly well documented. Second impact syndrome is a phenomenon where someone has an initial head injury and they have not fully healed. And then they get a second head injury, and because, I mean, basically it's a little bit difficult to explain, but the brain homeostasis and blood flow isn't normalized. So that second head injury causes massive brain swelling, and it can lead to death. Like the mortality rate's like 50% when that happens. So this is very rare, but there seems to be at least a few cases of this occurring a year. Post-concussive syndrome. So what that is that's when your symptoms of a concussion, all the things that we talked about, when they persist. So normally, 1 to 2 weeks, people's symptoms go away. When they last longer, weeks to months, that's when we're talking about post-concussive syndrome. So where symptoms continue for a longer period of time than you would have expected, and certainly significantly impact your kind of life. There's also worry about something called chronic traumatic encephalopathy, and this is new, and BU is really at the forefront of this research, and this is the theory that there are very long-term implications from repeat concussions. And there's a good video that was on the news that I'll play for you.
The family of retired NFL great Dave Duerson has decided to donate his brain for research into concussions. The former All-Pro safety died last week from a self-inflicted gunshot wound to the chest. Duerson was 50 years old and was concerned he was developing a degenerative brain disease. Duerson was a two-time Super Bowl winner with the famous 1985 Chicago Bears and with the New York Giants 5 years later. He made hundreds of tackles during 11 years in the NFL and 4 years at Notre Dame.
Football is unique in that we take about 1,000 blows to the head per year as a football player. And if you play 15 years, that's an extraordinary amount of brain trauma.
Repeated concussions can lead to chronic traumatic encephalopathy, or CTE, a degenerative brain disease that can lead to memory loss, depression, and dementia.
We can't diagnose it yet in living people, and we also can't treat it.
BU and other labs have identified more than 20 deceased football players with CTE. The Duerson study will take 3 to 6 months.
So that was a while ago, and his studies showed that he did have the same symptoms as those other people of chronic traumatic encephalopathy, meaning that his brain structure was abnormal. It had abnormal protein deposition and abnormal anatomy when compared to other people, and so that's what they were seeing a lot of in this study. Okay, so we kind of talked about why we care, and so now we'll start talking about what we're doing about it. So our concussion protocol. So we'll start with preseason baseline impact testing. So I'll tell you a little bit about what impact testing is in the next slide, and then the other piece is education, so things like this. And I do this talk in the community, and I go to the high schools for the season, particularly the football season, but fall sports, and we make sure that we try to get this educational piece out. So impact testing. So what is impact? Have people here heard about what that is? Do people know what that is? You guys have heard of it, obviously, yeah. But so it's basically, the goal is to develop some type of objective test to analyze how someone's doing with a concussion. Because up until now we rely on symptoms. So how do you feel? Okay? But you can imagine how accurate that might be. If someone wants to go back to play, they're going to lie. And so we're looking for something that's more objective to help us guide people back to play safely. So this is a neurocognitive test. It's designed to test multiple functions, so verbal memory, visual memory, motor speed, and reaction time. And the nice thing about it is we take it at baseline, so we say before you've ever had a concussion, before the season, here's your baseline. Here's your cognitive function before you've ever had an injury. Then if you have an injury, we get to compare a post-injury test, and we say, are you back to normal, or do you still have deficits? Okay? So it's a nice objective picture. It's not perfect, but it's better than doing nothing, I think is the point. It's one piece in the assessment on whether these athletes can return to play. And it's nice because you can actually do widespread screening online. So through Access, you can go to our website and we can do mass screenings where people log on from home and they take the test. It's like a 20-minute test. And then we have that on file for them. So if they ever have a concussion in the future, we can have a repeat test to make sure that things are normal before they go back to play. Okay? In high school particularly, we have them take it their freshman year and their junior year. Okay, so the protocol. So the first step is that we suspect a concussion during a game or practice. So we talked about it. Just a suspicion. Doesn't need to be a diagnosis. Suspicion. They should be immediately removed from play and not allowed to return that day under any circumstances. Okay? We would like an initial assessment by an athletic trainer. You know, in the high schools, that's what we're able to do. We have athletic trainers there. And so they can assess them, and if they have worrisome symptoms, they send them to the emergency room. But they use something called SCAT-2 testing, which is a sideline assessment, and that's where we get into some of the more objective things where you do some balance testing, some memory testing, and so you try to see if they have symptoms, but also if they have other kind of signs that might be consistent with a concussion. So then we give them verbal and written home instructions. Make sure that their parents are notified. And the big thing here is rest. So the treatment for concussions is rest, cognitive and physical rest. So what do I mean by that? That's what everyone asks. So physical rest. Basically, it's no activity that would raise your heart rate or your blood pressure. So you can eat, drink, walk, and sleep, and that's about it. Don't want you doing anything else that gets your heart rate up. Then the second piece is cognitive rest. So this is a little bit harder, okay? And so here's what I say. I tell people there's things you can control and things you have less control over. We have plenty of control over texting, phone calls, computer games, video games, for a long time in front of a computer screen or a TV screen. Just reading for fun, which kids don't really do these days much, but I have occasionally seen it. And so those things you really want to minimize. And then the problem is school. So what do you do for school? So you try to minimize schoolwork as much as possible until their symptoms are really resolved or very minimal. So I generally give people special school accommodations that with recommendations for the school, such as like no testing at this time, extra time to complete coursework, monitoring of symptoms, rest breaks as needed. All of those things should be accommodations that these students should have. Okay, so we've given them home instructions. The next step would be follow up with a physician. And you know, I say with experience in treating concussions within the first 1 to 3 days. And that can be with their primary care physician, could be someone like myself who specializes in concussions. And I even, a lot of times I'm in the high schools, so I can follow up with them in the high schools, which is nice. In the high school setting, we're able to have the athletic trainers really monitor their symptoms on a daily basis, so it's nice. So they can know, are their symptoms getting better, worse? They can report changes to me. I'm oftentimes in the school every week, so I can re-examine them at that point. So we basically wait. We wait until all their symptoms have gone away. Once all their symptoms have gone away, and they've been gone for an entire day despite normal cognitive exertion, so it means they could go to school, they could take their tests, they did all the stuff they wanted to do, that's when we can start them back to some graduated exercise. So there's a graduated exercise program that I won't really discuss, but basically you start from just getting your blood pressure up, 20-minute stationary bike. The next phase would be like jogging for 20 to 30 minutes, so you're adding movement. Then you're adding in sport-specific drills that add in a little complexity, and so on until they finally get back to play. Before we send them back to contact activities where they are at risk to get another concussion, that's when we would repeat that impact test. So we'd want to say, is your neurocognitive function normal? Because obviously I want it to be normal before we send you back. The reason why we have to do it is because the cognitive function can still be abnormal even when your symptoms have gone away. Okay? So then I basically look at their symptoms, how their balance testing is, what their impact test is, how many concussions have they had, how long did they have their symptoms, and then I decide on a final return to play. And everyone wants to know, how soon can I possibly get back? So usually it means you're missing the next week's game if it's a football game, because really 6 days is the soonest that you could possibly get back using our protocol. In younger people, we would be more conservative. So this is really for older people with concussions, but adolescents certainly we're a little more conservative with. So that's really it.